Now we're going to talk about a bunch of acronyms when it comes to Medicare, OEP and the GEP and the IEP and the SEP and the AEP, and it's just all so confusing. So a lot of people, unfortunately, are not getting the deadlines that they need to enroll or disenroll or change plans or whatever the case may be. So I have brought Mr. Medicare here, Ari. And with Chapter Medicare, he's helped, him and his team have helped a lot of people that watch my channel with all things Medicare. So I've invited him here to untangle all of the deadlines to make sure you get protected, you don't get charged extra, you don't lose your health care for a few months or years or whatever the case may be. So how you doing, Ari?
I'm doing great, Dr. Ed. So excited to talk Medicare with you.
And I understand you have some you have a little show and tell as well, huh?
I do. I have my Chicago Bears Medicare jersey.
The
I get
Bears.
made fun of when I go to the grocery store on Sundays wearing it.
All right. Are they just
Because,
tapping on your shoulder and says, can I talk about Medicare?
yeah, number 65.
Oh, okay. Who was 65?
It's a good question. I get made fun of by fans who are fans of rival teams because they say it should say 85 since that was the last time the Bears won the Super Bowl.
Yes, yeah, the refrigerator and all the rest of them, right? Yes,
Yeah.
yep.
William
I
Barron,
remember
that's
that.
great.
Yep. Okay, so all right, so this is also a live Q&A, so it looks like we already have a bunch of questions, and so we'll get into the different enrollment periods for about 10 or 15 minutes, and then we'll open it up to any and all of y'all's questions. So make sure you type them in there. If you're watching this on a recording later, make sure you subscribe, and that way you can join us next time, or you can reach out to Chapter. We've got the phone number there, and they could just walk you through all of the nightmare. All right, their help is 100% free, and y'all help people throughout the country, right?
Nationwide, all 50 states and the District of Columbia.
Okay, all right, and all right, so let's get in. Okay, so probably since it's still March, the Ides of March, actually. Beware the Ides of March, right? Well, Julius Caesar,
Beware.
Shakespeare there. So we've got two big deadlines coming up. So one is kind of a Social Security deadline, and the other one is a Medicare, not A and B type of deadline. So I'll tackle the Social Security deadline.
Sure.
In terms of the GEP, the General Enrollment Period. So that's the one you have to go to the Social Security Administration. Unfortunately, Chapter really can't. They can, give you some direction, but you actually have to go to the Social Security Administration. And unfortunately, nowadays, kind of good luck with that because Social Security has lost a lot of employees, and it's very, very difficult to get assistance. So if you're gonna try to get into this general enrollment period, you better do it quick because the days are marching by. So basically, what it is, if you forgot or didn't or failed or you left the country and you came back or something like that, and you need to sign up for Medicare Part A, Part B, or just Part B alone, whatever the case may be, then this is the time to do it. January, February, and March. You have to do it by March 31st. And yes, you just might get a penalty. It's a 10% penalty for every 12 months you did not have Medicare when you were supposed to. So if you left the country for 5 years or whatever the case may be, and you come back at 70 years old, and if you didn't sign up for Medicare when you were supposed to, I'll talk about what you're supposed to. If you didn't do it when you were supposed to, then you've got a 50% penalty. And 50% of what? 50% of the $185. You have to pay $185 plus 50% of that. And there's also a penalty for Part D, the prescription drug plan. But you have to sign up for that by the end of March 31st. And the law changed about a year and a half ago now. It used to be if you signed up during the general enrollment period, whether it was January, February, March, it didn't matter. Your Medicare Part A, Part B, whatever, would start July 1st. But luckily, Congress decided that's not great. So they changed it. So if you sign up January, your Medicare starts February 1st. If you sign up March, your Medicare will start April 1st. Okay. But if you have health insurance from work, if you were supposed to sign up at 65 or you were You received, you were eligible to receive Medicare because you were on disability for 2 years and you didn't sign up. If you had health insurance from work, current work, yours or your spouse's, and that employer, that group health plan had 20 or more employees, then you're good. You don't get penalized at all. So you can sign up pretty much anytime. You have 8 months. Once you lose that health insurance from current work, we're not talking COBRA, we're not talking a retirement plan, we're not talking about the Affordable Care Act, from current work, yours or your spouse's. So if you lose your health insurance, you're about to lose it, you technically have 8 months to sign up for Medicare to avoid the penalty. Technically 8 months, but you know what happens if you don't have health insurance for 8 months, right? That's usually when you actually get sick or somebody, steps on your toes or whatever the case may be. So it's always good if you know you're going to be losing your health insurance, then reach out to Social Security. If we'll talk about the special enrollment period here in a little bit, but reach out to Social Security and get your Medicare started, and that way your health insurance stops from work one day and at the end of the month, and the next day, the first of the month, your Medicare Part A and Part B and all that stuff. And then you can call Chapter and they can help you with all the rest of it. Okay. So I think I covered GEP, and do it as quickly as possible, because, you may think that, with all the offices, being understaffed, it's been understaffed for a long time, but it's even worse now. You may think your local office, you drive by your local office and you think it's open. There might be people in there, but Social Security offices are broken up into different programs. So the people that might need to help you with retirement or Medicare or Social Security disability, they might have quit or be, as we used to say in the Marine Corps, voluntold to leave. So the only people in the office only handle like SSI, this is the welfare-based benefits, supplemental security income, or vice versa. So nowadays it's good to do it as soon as possible. Okay, there's that. So Ari, do you want to tell us about the OEP?
Yes. I just want to lay a little bit of groundwork for your audience, though, because you're mentioning the general enrollment period. So there's 3 bite-sized decisions that your audience should be thinking about. The first is, how do I start Medicare? And so what Dr. Ed is saying is, if you missed your initial enrollment period by way of turning 65, and you missed your special enrollment period if you're past age 65 and coming off work-provided coverage, then you would use the general enrollment period to start your Medicare. And that period ends March 31st. Right now, we're also in the Medicare Advantage open enrollment period. This is for someone who's already started Medicare and is on a Medicare Advantage plan, and there's something suboptimal about it that they want to change. And what are the things that you might want to change about your Medicare Advantage plan? Well, you may have gone to the doctor last month or at the start of the year and discovered that one of your preferred providers isn't in network. That would be a good reason to reshop your plan and find one that has all your doctors covered, or the institutions that you would want to go to. Another reason that you may want to reshop your Medicare Advantage plan is if you discover that your prescription costs are too high, or you may have a prescription that isn't even covered. There's over 50 different Medicare Advantage plans in many different zip codes, and they vary across the United States depending on where you live. And so it's important to shop all your options and make sure that you're working with someone independent and unbiased who has all plan options available and is ready to discuss all of them with you. So you should ask that person, how often have you recommended a plan that doesn't pay you? You might be surprised by the answer. You should also ask, how many carriers do they represent? They might be captive to one insurance company, or the typical advisor is only appointed with 3 to 5 insurance companies. Make sure that you're working with someone who can evaluate all your options with you and has a way to programmatically search, based on your doctors, your drugs, and your priorities, which plan is the best fit for you.
All right, so that's OEP, and in terms of so that's Medicare Advantage. Can you do anything now in terms of Medicare supplement plans? Somebody had a question about that.
It's a great question. So there's two types of additional coverage. One is Medicare supplement. This is also known as Medigap. Lots of jargon here. Let's cut through it. Medicare supplement is also known as Medigap. It sits on top of original Medicare, and it covers that 20%. You can shop your Medigap plan at any time. So now is as good of time as any to see whether you're on the lowest cost Medigap plan, because Medigap is standardized under federal law for any given plan type. So if you're on plan letter type G, for example, which is the most comprehensive type for someone who recently turned 65, you can get a quote and see how your plan G compares to other alternative plan letter Gs or plan letter N, which I know Dr. Ed has talked about at length. And I'm happy to go through the difference between F, G, and N. Those are the three most common Medigap plan letter types. But you can shop that at any time.
I'm cheap like that. Sorry.
You have a really savvy audience, so they know these different letter types that I'm referring to. We can get really specific here.
Right. Okay. Let's. Yeah. So. So. Someone asked already. Hey, Ari. Do you think we will still have Medicare supplements in a few years?
Yes, I do.
Okay.
Yes.
All right.
I really do. Over half of Medicare beneficiaries are on original Medicare. Original Medicare isn't comprehensive insurance. In exchange for paying your Part B premium, you get 80-20 insurance. So the government picks up 80%, you owe the 20% coinsurance out of pocket, and sky's the limit on that amount. So if you have a hospital bill that's thousands of dollars, 20% of a very large hospital bill is still a whole lot of money. And so when you need some type of coverage for that 20%, people either choose Medicare supplement or Medicare Advantage. Those are the two ways to achieve comprehensive coverage.
All right. And someone, Elvin, thanks for the best information around. I'm a former CR, so that's a claims representative. And my thoughts are with all those still battling for all of us. Yeah, the people left in the Social Security offices, they've had a tough time. They've been the lowest staffing for 50 years. And so, and got Numi. That's an inside joke. That's the Numident. That's where Elon Musk is going after, where there's no money that comes out of that particular file. So it's a wild goose chase, but I guess it's fun to watch him. But anyway, all right. So what about, what is it? The numbers are about 11,000 people or so are turning 65 every day. So what do they need? What type of deadlines do people that are turning 65 this year have?
There's 11,000 Americans turning 65 every day. Here's what they need to know. The first question is, what is your health insurance going to be when you turn 65? A few options here. Dr. Ed has actually mentioned most of them. If you're turning 65 and you don't have the option of remaining on yours or your spouse's work-provided coverage, and that's active coverage, not COBRA. If you're on COBRA, you need to start Medicare by way of turning 65. Then you will have a 7-month initial enrollment period to sign up for Medicare by way of turning 65. And that period begins 3 months before the month in which you turn 65, and it extends to your birth month and 3 months after. So if Kevin were turning 65 on December 23rd, his initial enrollment period begins September 1st. And as long as Kevin applies for Medicare in September, October, or November, his Medicare will be dated to December 1st. It always goes to the first of the month. But if Kevin waits until his birth month to sign up for Medicare, his insurance is going to be delayed. So the question is, what is Kevin going to do for healthcare? Well, there's a few possibilities. You might say COBRA. You know at this point that COBRA isn't considered creditable for delaying Medicare. So you need to use your initial enrollment period if you're on COBRA. The next thing you might say is, well, what if I'm on an Obamacare plan? What if I'm on an Affordable Care Act plan? Guess what? If you're eligible for premium-free Part A, then you lose your Obamacare subsidies when you turn 65. So it's going to be a lot more expensive than signing up for Medicare. Then the other bucket is someone who works for a small group insurance plan. As Dr. Ed mentioned, in order to delay signing up for Medicare by way of your initial enrollment period, you or your spouse need to work for an employer with 20 or more employees. So if your employer or your spouse's employer has 19 or fewer employees, you need to sign up for Medicare by way of turning 65. And one more thing, Dr. Ed, there's a parade of terribles that happen if you don't sign up for Medicare timely. It's not just the penalties that you mentioned. You also don't have primary health insurance. So we were helping someone last month who had remained on COBRA and delayed signing up for Medicare, and they needed a $70,000 infusion. Because they hadn't signed up for Medicare, they didn't have primary insurance. So their COBRA was secondary payer, and they declined the $70,000 infusion, asking where the beneficiary's primary coverage was. And because they hadn't signed up for Medicare, they had to fork over a whole lot of money as a result.
Wow. Wow. All right. Let's see, Jill. When should you apply for Part D, G, B, D, G while still working but soon to retire? That's, yeah, once, if you're working for an employer that has 20 more employees, you're good. As soon as you know you're going to retire, then yeah, do it to it. In terms of parts, in terms of Part A and B and everything, if you are approaching 65 and you already have Social Security, you're getting the monthly benefits, then Medicare will essentially sign you up automatically. They'll send you your packet in the mail with the, the card in there with the A and the B and all that stuff. If you don't want it at that time, you just go ahead and refuse it. But if you want it, you just go ahead and keep it. And then you call chapter or whoever you want, and they'll help you with all the other things. But yeah, if you're still working, as soon as you know you're going to quit, then definitely start the process. Get signed up for, call Social Security or go online and set up for, sign up for Medicare if you're not already receiving those benefits. And to do it quick, unfortunately, there's going to be a lot of people that are going to be in a tough situation because of the cutbacks at Social Security. Because if you've got time, it sounds like, Jill, you've got time you're doing the right thing, you're planning and everything like that. So, maybe in 3 or 4 or 5 months, you're going to go ahead and retire. So you're doing everything right. So, call Ari and his team and they'll help you, navigate and figure out what G is good for you and what Part D and all that kind of good stuff. But the people that are really going to suffer are the people that are working and have health insurance from work. And all of a sudden, they get laid off, they get fired, the company closes down, you get sick or injured, you just can't work anymore, and your work stops immediately. And if you are eligible for Medicare, then that's great, but the problem is getting it started. You're going to call Social Security, and it's going to take them a month or 2 months to get you an appointment. Even if you file online, someone on the other side has to look at that claim and check your date of birth and check all this other kind of stuff. So even to process an online claim takes time. So I'm seeing a lot of people that are without any health insurance for a month or 2 months or 3 months. So it's good to plan as soon as possible, but unfortunately, of mice and men, sometimes
it's too consequential to delay.
Yeah.
And applying online takes less than 5 minutes. It's fast, easy, and secure to do it through your online Social Security account portal. You just click to begin a benefits application, and it asks you 2 questions. One, do you want to take Social Security? If you're not already, you can say no. Many people choose to wait until they're 70. Then it asks you if you want to start Medicare Part B. And if you do want to start Medicare, you would answer yes to that question and then click through the flow until you submit the application. Make sure you receive a notice that you've submitted.
Yep. Perfect. And if everything is good on the other side, then they'll just go ahead and push the button and you'll start your Medicare and you'll receive your Medicare card. Unless you're that 300-year-old person who got their Social Security card in 1976, and the person in 1976 accidentally wrote 1796, and you're that 300-year-old person, then Social Security is going to reach out to you and say, okay, it looks like they messed up in 1976, and so we need your birth certificate to correct it. And so that 300-year-old person might be out there waiting to collect benefits here pretty soon. So we'll find them popping up here. Zippy, I'm already collecting SSDI. Chapter found me a better health plan. I don't need to do anything else. Not in terms of Medicare. It sounds like Chapter took care of you.
I love that. Thank you so much, Zippy. I'm so glad that we were able to help you find the best fitting plan for your needs.
And I do this live pretty much every single day because I have no life. So and I get to stuff like this all the time. Y'all are doing phenomenal there. A guy named Jake is just, yeah, like he got a bunch of good response yesterday, good reviews. But yeah, in terms of SSDI, so you're good for Medicare. Um, One thing on, or there's a couple of things. Number one is you're on SSDI, so remember, if you got those CDRs, the continuing disability reviews, my philosophy on those is FCF. Forget about it. If your cycle is coming up for your continuing disability review, forget about it until it actually arrives. I did a video on that. Make sure you check out that video because it's completely budget driven. It's not about you. It's whatever Congress decides for the budget for those particular workloads. So forget about it. When you get the package in the mail, complete it, make a copy, send it in, and then forget about it again. Even if you send in that package, they might not do it because they might not have a budget. Number two is probably, depending on your state, all you had available to you was a Medicare Advantage plan. People under 65 on disability, in most states, you can't get a Medicare supplement plan, but that changes once you hit 65. So once you hit 65, you have an opportunity to at least check out to see if a Medicare supplement plan is best for you to, so you won't have a prior authorizations and limited networks and all that kind of stuff. So that's one of the things you should do when anybody on disability turns 65, call chapter, they'll give you the numbers, and if it's not right for you, then it's not right for you.
Yeah, can I say a little bit more here on
Absolutely.
the initial enrollment period too, which is what's being referenced? So if you're getting Medicare prior to age 65, then you actually get a chance to choose a Medicare supplement plan when you turn 65, and you can't be discriminated against. You can't be asked questions about your health history if you're in your second initial enrollment period. You can't be charged a higher price, and an insurance company can't decline you. So it's a very important period to mark on your calendar if you're receiving Medicare before age 65. A great time to discuss your Medicare supplement options, if you know that that's what you want, is 3 to 6 months before your 65th birthday. So that way you can go into the most comprehensive and flexible coverage.
Perfect. I forgot to add that on there about, the 65, they can't deny you and I can't charge you extra, right?
Mm-mm. Nope.
All right.
Now,
Good.
even if you're past age 65, let's say you're watching this and you're on a Medicare Advantage plan, that Medicare Advantage open enrollment period that we're in right now is also an opportunity for you to revert back to original Medicare. And in 46 states, you'll likely be asked questions about your health history if you're 6 months past having started Medicare Part B, because then you're outside your Medigap open enrollment right. But it's not, these aren't as scary as a life insurance exam, for example. There's no one who comes to your house and takes your vitals and draws your blood in order to get lab work. Instead, it's just a few questions about your recent health history. They vary insurance company by insurance company, but you might be able to get approved for a Medicare supplement plan. And then you would add a standalone prescription drug plan to make sure that your drugs are covered.
All right. Unless you want Ari to come to your house and talk about the 85 Bears.
I would love to. We should do a Q&A just on the Chicago Bears. Bears.
Right. The Bears. All right. Teresa has a question. Does that late filing penalty grow every year as the Part B cost grows, or stay the original dollar amount? No, unfortunately, is every year that the Part B increases, then that it's a 10% of whatever the Part B premium is for that year. And can you explain a little bit about the Part D penalty as well? A lot of people
Yeah,
miss that, get in the Medicare supplements. They say, I don't need drugs. So
right. So there's actually 2 late enrollment penalties. Dr. Ed has masterfully covered the Part B late enrollment penalty, and it's 10% for every 12-month period you delay signing up for Medicare. So if you delay signing up 60 months, then you owe 5 years of penalty, or 50%. On the Part D side, if you don't have coverage at least as good as what Medicare Part D provides, then you need to sign up for a drug plan. And if you choose, if you forego drug coverage, then when you sign up for Part D, you're going to owe 1% for every month you delayed. So if you delay 3 years, that would be 36%. And you owe that in addition to your Part D premium. And you also owe that in addition to your high earner tax, to your Part D surcharge, if that applies to you. And we might get some questions on the Medicare high earner taxes. It's also known as the income related monthly adjustment amount.
Good old IRMA. Yes, yes. I remember when they first came out with that many, many years ago, we also had an employee on our office named Irma. And then we went in there and had training on the Irma income related monthly adjustment amount. Everybody said, wow, thanks, Irma. So it became another nightmare workload that we had to deal with. But anyway, I'm sure a lot of people think it's a nightmare as well that have to pay that extra premium. So anyway, so let's see here. Donna, today I spoke with Mr. Stan, the man. I wonder if he called himself
Stan is
that.
the man. He
Oh,
is.
okay. All right. He is the
But
man. Oh, okay.
I'll let him know that we now have a nickname for him.
Okay, he is absolutely awesome. He got me all set up with the remaining parts and plans for Medicare since I'm turning 65 this coming July. So relieved and happy. Awesome. Awesome. Good to hear that. So yeah, I think this is number one in U.S. history. More people are turning 65 than any time in U.S. history. Last year, people said, wait, you said that last year. Well, it was correct last year too. More people turned 65 last year than any time in history, but this year beats it out. It's that phenomenon of the baby boomers from 1946 to 1964. 70 million plus Americans were born during that time. Let's see, Miriam. I have OPERS for my health care from working in a hospital. They always take out $172.85, and Social Security always takes out $185. Why are those numbers different? Can you figure that one out?
Yeah, so with OPERS, that is the Ohio Public Employee Retiree System. And the Ohio Public Employee Retiree System is a little different than other state retiree programs because in Ohio, I believe they don't deduct your Part A. So most people, the vast majority of people, pay into the Medicare Hospital Trust Fund. And that amount is deducted from their federal payroll taxes. And if you or your spouse has paid in to the Medicare Hospital Trust Fund, then you receive premium-free Part A. And you just need to pay in for 10 years or 40 credits. Potato. 10 years is 40 credits. And so if you or your spouse have paid in to the Medicare Hospital Trust Fund for 10 years, then you receive premium-free Part A. In the state of Ohio, they don't make that deduction for their public employees. However, when they when they become Medicare eligible, they still owe that $185 Part B premium. So $185 is the standard Part B premium for 2025. So that's where the $185 amount comes from. What I think that $172 charge that you're referencing is from is the cost of your retiree insurance in the state of Ohio. But just wanted to lay the groundwork there because Ohio is different. Ohio's public employee retiree system is different from any other state.
Yeah, and that's also the Social Security Fairness Act that was just signed into law, the HR 82. That I'm sure that applies to her as well. Let's see. Get Ari a coffee. My parents have Chapter's number, so $1.99. So
this person must have. They have my heart. They made it.
Got your coffee IV for the day. All right. What awesome. Someone, I can't find the question here, but someone is on NHS. They moved overseas to Scotland, and they have health insurance there. Mm-hmm. And they said when they come back, is that going to be credible coverage in the United States? Oh, here it is right here. I found the question. So will they have to pay a Part B penalty? Do you know on that one?
This is an expat who's living abroad and has Correct. Decided to defer Medicare Part B because they're receiving national health insurance in the UK.
Correct. It
is often the case that if you delay signing up for Medicare Part B and you don't have work provided coverage, which NHS is not, then you may owe the late enrollment penalty for Medicare Part B. So the general enrollment period that Ed kicked us off with would be your go-to in order to get your Part B activated. And you have until the end of the month, March 31st, in order to activate your Part B for April 1st. Now, in terms of the Part B late enrollment penalty,
there is some exceptions to that. Yeah, we had a few cases when I worked at Social Security. It doesn't happen very often, but it might happen in Martha's case. I would probably reach out to the American consulate or the embassy there in Scotland or London or wherever. And if it's part of the NHS, so it doesn't matter whether Scotland or England or Wales or wherever. But some countries, their national health insurance is considered credible coverage for the United States. I know I was looking up this for Japan. If you've got national health care in Japan, then you're good. If you come back to the United States, you don't get penalized. But
there's a few other countries where I've seen this as well.
But you will have to fight for it.
It really gets into the weeds, as
Yes.
you mentioned. And going to the consulate is a great suggestion. I'll add here too that when you get your Medicare started, you will have a special election period to choose additional coverage, be that Medicare Supplement, Medigap, or Medicare Advantage.
But you will have to fight for it when you go into the local office, because those don't happen very often. And the people at the front office, you know, the generalists that you first talk to and stuff won't have a clue what you're talking about. So unfortunately, I have to fight for it a little bit. And now, again, it's all bets are off because staffing is so low. But anyway, and they've lost normally those people would go to the back and talk to the people that have been around there for decades and, you know, the technical experts, but those technical experts are all gone probably now. So speaking of, I've actually brought a technical expert, Mai Jackson. So I've been helping people out on a one-on-one kind of interviews, but I'm cutting back on those. And Mai Jackson, who has, you know, worked at Social Security for decades, she's going to be helping people out. So if you want a private call, make sure you schedule one with her and she'll definitely help you out. All right. Time will tell. Social Security didn't credit my payment I made directly to Medicare when I made my first 3 months payment. All right. Payment type issue. This happens quite often, you know, because you have to send your check to Social Security. And I used to process checks in the office every day. I was the final one that signed off on them before we sent them to the payment center. And now there is no the payment centers are pretty much, gone. Anyway. But so you just have to call them up and say, hey, what's going on? And they'll check your bank. And if it was actually withdrawn out of there, then you know it's there. It takes time for it to come back and hit your MBR, your master beneficiary record, where everything is kept track of. One thing that you will also have an issue with is you've already paid for the 3 months. And, you know, if you go ahead and sign up for monthly Social Security benefits, then they take your Part B premium out of your Social Security check directly. But if you've already paid 3 months, sometimes you have an overlap there of a month or 2 months where you're like, I already paid these 2 months. Why are you taking out? It'll work itself out.
It should get reconciled. We've seen dozens of instances where someone made a payment because they received the invoice, and you definitely want to pay that invoice. Otherwise, your Medicare will be terminated for non-payment. And if that has happened to you, then the general enrollment period is certainly the way to get your Part B activated. But it should get reconciled.
Yes.
And
you'll have
one
a credit. Sure, go for it.
Ed, Medicare Easy Pay. If someone is worried about missing a payment for their Part B premium or for their Medicare High Earner Tax, IRMA, like you mentioned, set up Medicare Easy Pay through your Medicare.gov account, because that way they pull it out of your bank account until you start Social Security. And when you start Social Security, then they just deduct it from your Social Security check.
Perfect. Perfect. All right. Karen says, thank you and all your staff for helping us with Medicare. Loved it's not all that complicated. And Charles Moran helped me get the best plan G possible. All right. Good deal. Let's see. I will be 65 October 2025. I like it. Planning ahead. Excellent.
Love it.
When do I
Great.
have to sign up for Medicare only? Get the 40B. How can I pay bills in Medicare?
Okay.
All right. It
Let's
won't
do
need
it.
the 40B, right? Go for it, Ari.
So turning 65 in October, that means that Jimmy's initial enrollment period begins August. So on August 1st, Jimmy can go into their online Social Security account portal and begin their benefit application to enroll in Medicare. Their Part A and Part B will be dated to October 1st, unless Jimmy was born on the 1st of October, in which case Jimmy will get Medicare a month early, starting September 1st.
And so she won't need the 40B and the 564. The 40B and the 564, those SSA CMS forms, are for the special enrollment period. Okay, so if you if you're smart and you refuse your Part B when you turn 65 or something, and you refuse it because you have health insurance from work and your employer has 20 or more employees, yours or your spouse's, because why I say smart is because there's, well, I shouldn't say smart. The whole thing is way too complicated because there's a lot of people that are paying the $185 for Part B and they already have health insurance, but they think it's mandatory. It's mandatory unless you have it. So, but so you're doing the right thing there. But if you have health insurance from work at 65 years, your spouse, 20 or more employees, then you just refuse Part B, no penalty whatsoever. And let's say you turn 70 and that's when you decide to stop working and you lose your health insurance. Then you need those two forms, the 40B and the 564. The 564 is one you take down to your employer and your employer fills it out and says, yes, Jenny or whoever had health insurance from work since she turned 65. And so don't penalize her. What a lot of people miss is that you might need 2 of those forms or 3 of those forms or 4 of those forms. If you're signing up for, the Part B at 70 or 75 and you had 2 or 3 employers, you need to cover all of that time since you were first eligible to file for Medicare. So if you work for 3 different places, unfortunately, you have to get 3 forms.
Yes, this is a really important point that people overlook if they've changed jobs past age 65.
All right, let's see here. What are the kind of okay? Let's see here. What about if some of this? Hopefully, it doesn't happen. As all right. What about people losing Medicaid? That if more people possibly might lose Medicaid, we'll see what happens with the budget coming up here. But people lose Medicaid on a regular basis, when they
Right.
get a job or something like that. But so
Right.
if there's a whole bunch of people losing Medicaid, what type of other things do they need to check out in terms of Medicare, the Medicare savings program? Can they switch their Medicare Advantage plan or go to a Medicare supplement? Anything there?
The answer is yes. Let's go through a checklist. So if you just lost Medicaid, the first thing that you can do is appeal your determination. And if you're still below the income threshold, then that should be your first course of action, to appeal the determination of you losing Medicaid. With that said, losing your Medicaid creates a special election period to change your coverage. And so this would be an opportunity for you to shop for a different Medicare Advantage plan if you've been on a dual special needs plan, which is a type of Medicare Advantage plan for those who have Medicare and Medicaid. It coordinates benefits between the two. And it also might be an opportunity, if you can afford it, to consider Medicare supplement.
So that you get a special enrollment period, a special election period, if let's say you're 70 years old and you lose Medicaid, do you still have to go through the health underwriting and everything?
If you lose your Medicaid coverage at 70, then you'd have an opportunity to choose different coverage. There are some protections for people who are losing Medicaid, and it may create an opportunity for you in certain states to obtain a Medicare supplement plan by way of guaranteed issue. So in that case, you would not need to answer any questions about your health history.
Perfect, perfect. And then people that lose Medicaid, if they have those Medicaid, the Medicare Advantage dual eligible plan, and those are the ones you know, I'm sure Ari is frustrated as much as I am of, you know,
Yes.
companies and agents out there advertising. They find the best grocery card in the country that provides you, you know, $500 a month and free ice cream and unicorns. And, you know, it's only in, you know, East Texas, but
Right.
they advertise it to the entire country. And then people
Right.
from all over the country call and they say, "Oh, do you live in Paris, Texas?" "No, I don't live in Paris, Texas." "Well, sorry, it's not for you." So, and then they give you the hard sell. And those things do exist. The grocery cards do exist. They help you with, food and some electricity, and there's, you know, travel and, you know, all kinds of different things, but it really depends on your zip code, right?
It really depends on your zip code. We've all seen these commercials that promise the sun and the stars. It varies county by county across the United States as to whether those additional benefits are actually offered where you live. And with that said, you never want to choose your health insurance based on the goodies. You want to choose it based on your 3Ps, which is what I write about in It's Not That Complicated. That's my short book on Medicare. Your 3Ps, and this is the way we train our team here at Chapter, are your providers, your prescriptions, and your priorities. If a plan meets all of your requirements, then it can be in consideration the dental, vision, and hearing that it covers. But you never want to choose a plan based on some promised additional benefit when you won't be able to see the doctor who you need to see or go to the hospital that's more convenient to you.
Yep. Yeah, free ice cream and gym membership is awesome, but yeah, not if it's going to cost you a whole bunch of other things. You can't see the doctor you want. All right, let's see here. Another
Can I say
question.
one more
Sure.
thing about that question about the person who's losing Medicaid? Even though you've lost Medicaid, you still might be eligible for Part D extra help. Part D extra help will help you with your prescription costs. And the Social Security Administration estimates that it saves people who are eligible approximately $5,100 per year. So know that you still might have some relief for your prescriptions, even though you've lost Medicaid.
And if you have Medicaid, I know the regulations changed this year in 2025. Last year, if you had Medicaid or extra help, you could change your Medicare Advantage plan several times a year. It changed this year, correct?
Right, right. Now, beginning in April, so you can still change for the month of March because we're in the Medicare Advantage open enrollment period. But beginning in April, you'll only be able to change to an integrated dual special needs plan. And so it will depend whether there's an integrated dual special needs plan that's offered in your specific zip code.
Yeah. So if they already have one of those, can they switch to another one
Yeah, they'll be
anytime of
able
the
to
year?
change, right. They would be able to change to a different integrated
Yep.
dual special needs plan once per
Perfect.
month.
And what about the people that are receiving extra help, just extra help and not necessarily Medicaid?
If you have a change in your extra help status, let's say you lose your Part D extra help, then that is another valid special election period. Or if you begin receiving Part D extra help, that would also be a valid special election period.
Perfect. That's why we're doing this special thing. The whole thing is we won't even get into disaster SEPs. That's a whole different yeah. Anyway, basically, what the disaster? Do you want to give a couple of sentences on disaster SEPs?
A disaster SEP, that's a FEMA declared natural disaster. So, for example, a FEMA declared natural disaster would have been the fires in California. If that caused you to miss a valid enrollment opportunity, so for example, if because of the fires in California, you were forced to move out of your house and you weren't able to review your coverage, then you may have an opportunity to review your plan. It depends on your circumstances, though. and whether a natural disaster has been declared by FEMA where you live
Yeah.
and whether that affected you. That is, whether it caused you to miss an enrollment period.
Yeah, the way they determine those disasters is always strange. It's like Vegas gets an eighth of an inch of snow, and that's a disaster. But anyway, how long after you start Medicare do you have to switch to a Medicare Advantage plan, or do I have to wait until the next open enrollment period to switch? What do you say, Ari?
So this person is on original Medicare, and it sounds like they didn't choose some type of additional coverage. So let's just apply our bite-sized decision framework. The first question is how to enroll in Medicare. This person has enrolled, but they only have original Medicare. The second part of the framework is what type of coverage will you use to cover the 20%? And here there's two options. There's either Medicare Supplement, which is Medigap, or Medicare Advantage. So this person is asking, what can I do? Well, if you're within 6 months of having started Medicare, having started your Medicare Part B, then you're still in your Medigap open enrollment right. And you can choose any Medicare supplement plan without questions about your health history. And a carrier cannot decline you, and they can't charge you a higher price. What about Medicare Advantage, though? Well, for Medicare Advantage, it just depends how far along you are. If you're several months past having started Medicare, and you haven't had the opportunity to choose some type of additional coverage, then there might not be an election period for you until the fall when the annual enrollment period begins. And the annual enrollment period is from October 15th to December 7th. But we're going to need to do some fact finding on just how long it's been since you started original Medicare to know whether there might be a special election period for you and whether you've had the option of some type of additional coverage. Because if you've had the option of other coverage, then that could create another special election period for you to choose a Medicare Advantage plan. So for example, if you've had VA benefits, right? If you're a veteran, that would create a special election period in some circumstances to choose a Medicare Advantage plan. But if you're on TRICARE for Life, which is for retired service members, then you want to stay on your original Medicare because you receive a free Medicare supplement plan from the Department of Defense as a thank you for your service.
All right, I've got two things I want to talk about before we end here. Since you talked about veterans, we all saw in the news that they want to cut 80 to 83,000 employees from Veterans Affairs, and those are the people that help veterans out in local VA clinics throughout the country. And being a veteran myself, I always try to look out veterans, and so a lot of veterans, they have been happy with the VA service and everything. And so they refused Part B, or they got a Medicare Advantage, a zero premium, and they never really checked it because they really don't use it. So they have until March 31st. This is an important deadline. So any veterans out there, if you know any veterans, make sure you tell them to call Chapter, or anybody that helped them out, and have them check their plan, because it's like, hey, you're a veteran, you use VA, and it's like, yeah, but do you also have like Part B and a plan, a Medicare Advantage plan? I would definitely check that. You might not have checked it in the last few years because you didn't need it. Now is a good time to check it. And number two, if there's a lot of vets that say, no, I'm completely happy with the VA, so I refused Part B. And maybe that was fine 2 weeks ago, but it might not be fine, here on out. So just something to check out. There are called Medicare Advantage Part B giveback. And because it's like, I don't want to pay the $185. I'll take my chances. There's a kind of get out of jail free card, I guess, have your cake and eat it too. You can get a Medicare Advantage Part B giveback, and it depends on your particular area. That Part B giveback might pay $50, $100, $185 of your Part B. So you'll have your fallback in case something happens with the VA. And you might not have to pay for the whole thing. If what type of trends are you seeing with those Part B givebacks throughout the country? Are they still pretty generous this year as well?
As you mentioned, Dr. Ed, it varies zip code by zip code as to whether a Medicare Advantage with the Part B give back is offered. So broadly, what I want to say here is in exchange for that give back, don't sacrifice your 3Ps. Don't choose a plan that doesn't have your doctors covered, doesn't have all your drugs covered, and doesn't meet your priorities just to obtain the Part B give back. That Part B give back is icing on the cake, as you said, and it's going to vary depending on where you live, whether it's offered.
Perfect. Yeah, that's what I say all the time. It's like, you got this because, these health insurance companies, they're in it for a profit. So they're like, we're paying this person's $185 but we're not paying this person's $185. So, if this person goes to the hospital, we'll charge them $200 a night. This one will charge them $50 a night. So yeah, you definitely have to check the entire thing. But okay. And then, so if you never signed up for Part B, remember you have March 31st. You only have a couple more weeks to get that done. And then you go ahead and, sign up for, whatever you're looking, supplement or Medicare Advantage or Part B give back or whatever the case may be. Or if you already have one, you haven't checked it, it might be a good idea to double check it to see if it's something that is really going to be good, because you're like, well, I've had the same plan for years. No, nobody has had the same Medicare Advantage plan for years. You might have the same card in the same company, but all of the details, I always say it's like, you bought a Corvette 3 years ago, and then, earlier this year they came in and, threw a Pinto in there, and, you didn't know about it. So that's how those happen. All Medicare Advantage plans, Cinderella, December 31st at midnight, and a new one starts the next day. If you don't do anything, you just take what the new one gets, right?
And if you didn't do that type of comparison in the fall, then you have until March 31st in order to review your Medicare Advantage plan.
All
That's
right.
the Medicare Advantage open enrollment period.
Perfect. So March 31st. So reach out to Chapter as soon as possible. All right. So, and I want to leave on something that is going to help everybody else out. All of these annoying phone calls from Medicare people, they're not supposed to do that. And people, send me emails and stuff. Hey, tell Chapter to call me. And I said, I can't. I can't. Chapter. If I tell Chapter, I know exactly. Hey, Ari, call Diane. Can you call Diane for me?
No.
That's the answer. That is the correct answer. So you have to call Chapter. I cannot tell them. If you have Chapter helps you out, and then you say, hey, I have a brother or sister that really needs help. Here's their phone number. Can't do it.
Can't do it.
That's the correct.
That is the
correct answer. That is the correct answer. But unfortunately, it's not happening that way out there. So people are getting your number. You press a ad on Facebook or whatever, and then somebody calls you up. You give them authorization, but then you don't like what they say, and you're good at that time, and then they give your phone number to everybody else out there, and that's how you get all those calls. So do not call list, number one. If you didn't tell them specifically to call you, what kind of things can they do to prevent these harassing calls?
Well, they should certainly say if you're being harassed by another Medicare advisory, if they're trying to reach out to you, or if they're doing lead gen some of these places are just calling you, trying to get you on the phone, and then transferring you over. They're selling that live person that they have to a Medicare broker. And if you're receiving those types of unsolicited calls, make sure that you communicate that you don't want any further calls. And then what Dr. Ed mentioned, so you say, do not call. And this happens to me all the time. I was called 3 times in a row just as I was presenting with Dr. Ed. So make sure that you let the person know, do not call, add me to your do not call list. Then, as Dr. Ed mentioned, there's a do not call national registry that you can add yourself to. And I just also want to note, it goes beyond calls too. And this is why there's been a swell of people that Chapter has been able to help. Tens of thousands of people just last quarter alone. Because We are the only independent, unbiased Medicare advisory. We help you evaluate all your plan options based on your 3Ps, and there's no charge for our services and there's no strings attached. And we'd love the opportunity to help you. Give us a shot.
Okay, perfect, perfect. That's why my son and I looked. We didn't really want to get into all that. I wanted to help people with Social Security, retirement, survivor benefits, disability. Obviously Medicare Part A and Part B because that's Social Security. But people needed help with the supplements and the and the Part D and the Medicare Advantage, and there were just so many people out there providing incorrect information. And one of the things that one of the many things that really this why we chose chapter is because you're a member success team. A lot of
Yeah.
places, once they sign you up, then they don't want to hear from me again. Don't bother, don't call me anymore. But y'all have an awesome member success team. And what are some of the things y'all help with after the fact?
Our support is ongoing, and there could be hiccups as you transition to Medicare. And some of the common ones are, first, if you're a high earner, it can be appealing that that Medicare high earner tax that Dr. Ed mentioned, IRMA. Another thing that we can help you with is prior authorization. So if you're on a Medicare Advantage plan and there's some type of medical services that you need, we can help obtain prior authorization from your doctor to fight the insurance company on your behalf. You don't have to call the insurance company. You call chapter, and our member support team will help you get to the bottom of it. And the same thing applies to prescriptions as well, because Medicare Part D is also subject to prior authorization. So if there's a prescription that your doctor would like you to take, but it's subject to prior authorization, then we know the ins and outs, and it varies insurance company by insurance company, and we will help you to the best of our ability get the medication that you need. And
Awesome.
the list goes on.
Awesome. Awesome. All right. All right. We are over an hour here, and I sure do appreciate it, Ari. You're awesome as usual. And yeah, definitely reach out to Ari and his team if you need help by the end of March 31st. If you have any friends, family, or relatives, next door neighbor, a little old lady down the street needs help, make sure they're evaluating their plan. A lot of people, just kind of go on automatic pilot, and health insurance companies love that because particularly health, the Medicare Advantage plans, they downgrade it a little bit sometimes every month, depending on, where you're at. And, they've got people on an older plan from a year or 2 years, 3 years ago that they're making tons of money off of. And they're like, we hope this person doesn't, reevaluate their plan and upgrade to one where we actually have to pay out more. So, but we need to be smarter in them.
And we will find the best fitting plan for your needs. It does not matter whether it's a company that pays chapter or not. Our advisors are blinded to that based on our proprietary software that evaluates your options based on your 3Ps.
Perfect. Perfect. All right, Ari. Hey, I sure appreciate it as always. And you take care of yourself and everybody else. Please have a great night.